Hi there, this is Dr. Paul and thanks for tuning in to yet another video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about oral cancer. Now before I go any further, I want you to watch this short video from Michael Douglas.
In a world where cancer is almost a daily part of the news, one cancer isn't heard about enough. Oral cancers are increasing in the U.S., and as in my own case, most people know little about them. Like many, I thought that this was a cancer that impacted much older people who had used tobacco most of their lives. While that's still a problem, the fastest growing segment of the people developing oral cancers are young non-smokers. A very common virus, one responsible for the vast majority of cervical cancers, is now identified as a cause of this rapid rise in oral cancers. Thankfully, in a fast, inexpensive, and painless visual and tactile screening, a medical or dental professional can often identify early-stage disease. So please, the next time you visit your dentist or your medical doctor, ask for this simple screening. Finding oral cancer in its earliest stages may save your life.
Now that you've seen that video from Michael Douglas, you'd appreciate the gravity of having regular oral cancer screening done on you by either your dentist or your MD. What is oral cancer? Oral cancer is cancer involving your mouth, your throat, your pharynx, and even the upper part of your esophagus, which is the food pipe. The mouth is a very vascular area, and that is basically why everything looks very red, and your gums and cheeks can disguise or mask oral cancer unless someone's looking for it with special tools. Back in the day, us dentists used to use our eyes and our fingers to look and feel for things that felt a little strange. The only problem with this technique is when you are diagnosed with oral cancer, because of how easy it is to miss things, you're already in stage 3 or 4. Just to give you a perspective, what stage 3 and 4 is basically, it is a part of cancer wherein there's been a lot of spread or metastasize of cancer to other parts of the body, and also there's 80% mortality rate from having being diagnosed in stage 3 or 4, which means if you take 100 people, after 5 years only 20 people survive and 80 people die. Now that's a huge number. What usually happens is when you also get diagnosed with oral cancer in the later stages, a lot of complicated and very disfiguring surgeries have to be performed, wherein you lose part of your jaw, your complete jaw, part of your upper face, or even worse, your lower part of the eye or even an eyeball to oral cancer. Having worked in cancer clinics, I've actually seen disfiguring surgeries firsthand, and it's unfortunate because all this could be avoided by regular screenings and such. Yet in the year 2016, only 20% of dentists actually use these special instruments, oral cancer screening aids out there on patients to make sure that you're screening patients regularly for oral cancer. Here at Waterfront Dentistry by Paul's, we use the latest state-of-the-art technologies to look for oral cancer in every one of our new patients and every one of our patients coming for recare. In fact, our dental hygienists here once a year will also be checking for oral cancer for anyone and everyone who attends our hygiene program. Now that you know this, you also have the urge or the questions that a lot of people have, which is, hey, I'm looking into my mouth through a mirror and I feel something that is strange or looks a little funny. What do I do? If you ever think that you have something strange in your mouth or something that's not quite right, and if it doesn't really go away within 2 weeks or 14 days, reach out to your dentist. If you don't have one, give us a call, send us an email, and we'll see if we can accommodate you and have a quick check. Here are a few people in the public eye that have had oral cancer that you might have not known of. Eddie Van Halen from the group Van Halen, Ulysses S. Grant, a US president, Humphrey Bogart, Lana Turner, these are all actors, the late George Michael, Elton John, even Sean Connery had oral cancer. So there are some big personalities or media figures that have had oral cancer, and some of them have even died from, unfortunately, this disease. And all this is because early detection was not really taken a priority over. Thanks for watching, and like I said again, if you have any doubts, please shoot us an email. Thank you.